Hepatitis C, a significant viral infection affecting the liver, was first discovered in 1989. Before its discovery, the virus was often referred to as non-A, non-B hepatitis, because it was identified as a form of liver inflammation that was not caused by the already known hepatitis A and B viruses. The discovery of hepatitis C represented a major advancement in medical science, particularly in the field of virology and infectious diseases, and has since led to the development of better diagnostic tests and treatments. Hepatitis C is primarily transmitted through exposure to small quantities of blood. This can happen in various ways. Sharing needles, syringes, or other drug injection equipment is the most common mode of transmission, especially among people who inject drugs. Inadequately sterilized medical equipment, particularly needles and syringes, can transmit the virus in healthcare settings with poor infection control practices. Before the widespread screening of the blood supply that began in 1992, HCV was often spread through blood transfusions and organ transplants. This route of transmission is now rare in countries where blood is tested for HCV. A mother infected with HCV can transmit the virus to her baby during childbirth, although this is less common. The risk of transmitting HCV through sexual intercourse is considered low but can be higher in certain situations, such as among individuals with multiple sexual partners or those who have a sexually transmitted disease. Sharing personal items that might have come into contact with another person's blood, like razors or toothbrushes, could potentially pose a risk. Getting tattoos or body piercings in unregulated settings with non-sterile equipment can also be a risk factor. HCV is not spread through casual contact, such as hugging, kissing, or sharing food or drinks. It's also not spread through breast milk. Hepatitis C is a liver infection caused by the hepatitis C virus, HCV, and can lead to a range of symptoms, although many people may not exhibit any signs, especially in the early stages. The symptoms, when they do occur, can include fatigue, one of the most common symptoms, mild fevers, decreased appetite, leading to loss of weight, nausea and vomiting, sometimes accompanied by abdominal pain, aching in the joints, dark urine and changes in stool color, such as clay-colored stool, jaundice, which is the yellowing of the skin and eyes due to the buildup of bilirubin, persistent tiredness in the chronic phase, easy bleeding and bruising as liver function worsens, fluid accumulation in the abdomen, ascites, and swelling in the legs due to changes in liver function and blood flow, itchy skin, related to liver dysfunction, spider-like blood vessels on the skin, known as spider angiomas, memory problems and confusion in advanced stages, indicating potential liver dysfunction affecting brain function, drowsiness and slurred speech, also signs of advanced liver disease impacting brain function. It's important to note that many people with hepatitis C might not show any symptoms for years, and the virus is often detected only through routine blood tests or after liver damage has begun. If you suspect you may have been exposed to HCV or experience any of these symptoms, seeking medical evaluation is important. Hepatitis C treatment has seen remarkable advancements, particularly with the introduction of direct-acting antivirals, DAAs, which have transformed the approach to treating this condition. These medications are specifically designed to target and stop the hepatitis C virus from multiplying, offering cure rates of over 90% in most cases. The typical course of treatment with DAAs usually lasts for 8 to 12 weeks, depending on the specific medication regimen, the genotype of the hepatitis C virus, and the patient's liver health. Some patients, especially those with more advanced liver disease or previous treatment failures, may require longer treatment durations. Compared to older treatments, DAAs have significantly fewer side effects, which are generally mild and can include headaches, fatigue, and nausea. After completing treatment, a cure is often indicated by having no detectable hepatitis C virus in the blood 12 weeks later, known as a sustained virologic response, SVR. Achieving an SVR typically means the patient is cured of hepatitis C, significantly reducing the risk of liver cancer and other complications. However, it's important to remember that curing hepatitis C does not confer immunity against future infections. Access to these medications can vary, with costs potentially being a barrier depending on healthcare systems and insurance coverage. In addition to antiviral medications, doctors may recommend lifestyle changes, such as avoiding alcohol and losing weight, to help protect the liver. Vaccinations for hepatitis A and B may also be advised, as having hepatitis C can increase the risk of severe liver disease if infected with these other viruses. For those with advanced liver disease, close monitoring and management of complications like liver cirrhosis or liver cancer may be necessary. It's crucial for individuals with hepatitis C to work closely with their healthcare provider to determine the best treatment plan for their specific situation, offering many a high chance of a cure and a healthier future.